Hello, and welcome to Healthcare Information Systems. The increasing use of technology by healthcare facilities requires that nurses have a basic knowledge of the types of information systems used, the purpose and abilities of these systems to support patient care, and the nurse's responsibility related to these systems. In the days of paper charts, only one individual at a time could access a patient's chart and add information to it. A clinical information system allows multiple disciplines to simultaneously access the patient's chart and record data that can be viewed and analyzed by a number of healthcare providers in real time, providing the most accurate and current information about the patient so that the best decisions about the care of that patient can be made. A clinical information system must give the nurse the ability to access patient information and provide data necessary for the nursing process of assessing, diagnosing, planning, implementing, and evaluating the care of the patient. When the system is used at the point of care, the nurse can immediately record patient information based on assessment of the patient's current condition. For example, if a blood glucose is obtained. The nurse should also have access to diagnostic data, including laboratory values and imaging, diagnoses, assessment, plans, and evaluations of the patient from viewpoints of other healthcare professionals, including physicians and therapists. Pharmacy information, such as medication, route, dose, and time, should be available in the patient's chart in real time. The chart should also include safety features, such as warnings for drug interactions or incorrect doses. Computerized medical records. On the surface, a computerized medical record may appear to be nothing more than a digital form of a patient's paper chart. Many systems start out that way. However, rapid technological advances have transformed these static charts into dynamic systems. The purpose of a computerized medical record is to unify a patient's entire health history into one single source of information about the patient's health, including the patient's medical and surgical histories, diagnostics, tests and treatments, medications, and therapies. It is meant to be multidisciplinary and multi-specialty in nature. It is meant not to simply record the past, but to aid clinicians in the patient's future health care, improve quality of care, lower the costs of care, and facilitate research. It is meant to be portable so that if the patient lives in New York but requires emergency care in Los Angeles, all of the patient's medical information is available to help the healthcare providers in Los Angeles make the best possible decisions about the care of the patient. A survey found that 78% of physicians using electronic health records reported that their use enhanced patient care overall. 81% of physicians indicated that it helped them access a patient's chart remotely, and 65% stated it alerted them to a potential drug error. To deliver the best quality of care, promote safety, and maintain efficiency, computerized health records should contain the following functionality. Patient support. Patients should be able to access their health records. Patients can take a more active role in their care if they have the ability to track appointments and health maintenance, monitor their weight and laboratory results, and access educational materials related to their health condition. Health information and data. Important data such as chronic and acute medical and psychiatric diagnoses, medications, allergies, and diagnostic tests can help clinicians make rapid decisions if necessary. Administrative processes. This is the ability to manage schedules, insurance information, and inventory can help healthcare facilities focus on patient-centered care. Results management. This allows access to past and current diagnostic tests that allows and helps clinicians recognize changes in a patient's state of health faster. Reporting. This allows healthcare facilities to comply more easily with regulatory requests and help report disease surveillance and patient safety measures such as medical device recalls. Secure electronic communication and connectivity. This allows for secure and accurate communication between medical providers at different facilities that are caring for the same patient, help with continuity of care and timely diagnoses. Order management. Computerized physician order entry, often referred to as CPOE, helps with accuracy and decreases time from order to treatment. CPOE should be available for pharmacy, laboratory, radiological studies, and ancillary services such as physical and occupational therapy. And last, decision support. The care of the patient can be enhanced through the use of clinical decision support system. These systems can display best practice standards, notification for preventative screenings, and alert for drug interactions. Terminology. A nurse will hear many terms to describe a computerized medical record, and the list will probably continue to change. The two most commonly used terms for electronic medical records and EHR. Electronic medical records, or EMRs, are similar to an electronic chart used in a clinician's office. Their focus is on diagnosis and treatment. They can help track information over time, such as weight, blood pressure, and cholesterol, and identify when patients are due for routine preventative health maintenance, such as vaccines and mammograms. A disadvantage of these systems is that most of them are designed to stay within a clinical setting and are not meant to travel beyond it. A patient who needs to see a specialist may need a paper printout of the EMR to take to the specialty appointment. An electronic health record, or an EHR, gives a broader view of the patient's health. They are designed so that multiple clinicians from multiple disciplines can all have simultaneous access to the patient's health information. This access provides patients with a more comprehensive management of their health and is designed to improve the quality of care they receive. Electronic health records enhance communication with other clinicians. They provide easy access to patient information. They can provide automated formulary checks by health plans to avoid problems with prescriptions. And they can link to public health systems such as registries and communicable disease data banks. One significant advantage is e-prescribing, in which healthcare providers can communicate directly with the pharmacy to order prescriptions. This can reduce errors, lower costs, and improve care. Real-time documentation of patient data can help all clinicians care for the patient. The nurse should be given the tools to record assessments, nursing diagnoses, plans, interventions, and evaluation. The work that nurses have done in caring for the patient has traditionally been invisible to other disciplines, so the ability to carry the nursing process over into electronic records will help promote the work that nurses do in caring for the patient. Uniform language is the consistent use of the same terminology among providers, facilities, institutions, and organizations when describing all patient data, including that pertaining to assessment and treatment. Uniform language is vital for communicating to other nurses and health professionals that value the nurse's care that is provided to the patient. NANDA International has been involved in developing uniform language for nursing since the 1970s. NANDA diagnoses are available in many electronic health systems. The nursing intervention classification includes both physiological and psychological intervention that nurses perform with patients and their family. Nurses use both NANDA and the nursing intervention classification to formulate care plans for the patient in the electronic health record. The nursing outcomes classification is designed to assess the outcomes of patient based on the nursing interventions performed. Both nursing intervention classification and nursing outcome classification have been approved for use in the Health Level 7 terminology, which provides a framework and composes standards for the exchange, integration, sharing of electronic health information that supports clinical practice in the management, delivery, and evaluation of health services. This week's reading assignments consist of Pearson, pages 2811 to 2813 and 2815 to 2820. Thank you, and please let me know if you have any questions.